So I'm Karen Gallagher. I'm the General Manager of Strategy and Consumer Experience at Healthdirect. We are the national provider of trustworthy health information, and we connect people to care 24/7, and we're owned by all 9 governments of Australia. So in my role, the real focus I've been taking over the last year is to be looking at how we can understand more about consumers' needs and their behaviours, about why they're going to emergency, how can we support them to care for themselves and use our health information effectively to both make sure that they're as well as they can possibly be, but also to ease pressure on the system and make sure they get to appropriate care.
Yeah. No, look, it's great to connect, Karen. And I just thought as you were talking, it's almost like Healthdirect is like my Pokemon because I'm catching them all at different... We can run with that one. That's cool. It's totally on brand. But important message that you've... Because we've spoken with a number of people at different events from Healthdirect and some longer form episodes that people can go and check out on the feed. So it's great to be able to connect here at Digital Health Festival. And I understand you're speaking on a stage as well. Tell me a little bit more about what you're covering.
Yeah, so I'm speaking about looking after yourself, so self-care, and what we might be able to do to help people to follow our advice when we provide that. So when you think about the health system over the last couple of years, a lot has changed. A lot of new pathways have been added, virtual pathways, urgent care clinics. One of the pathways that is, I guess, not really recognised as a pathway is people looking after themselves. And on our helpline at the moment, about 16% of our callers are advised that it's okay to stay home and look after themselves. But what we're finding is that they don't always follow our advice. And so we wanted to look into why that is and why are people potentially going to emergency or to something other than what we recommend.
So they say, hey, you're fine, but then they go into ED or something regardless, right?
Yeah. And or they might go and see their GP, even though we've said you can stay home. And so we've been looking at understanding from consumers what's the why behind that behaviour, and then how might we support them to follow that advice. And so part of the reason for this is that when we look at the pressure on our system, we know that there's a lot of people going to emergency that maybe don't need to go to emergency. And we also know that we've got a workforce challenge.
Yes.
And so it doesn't matter how many new pathways we put in, if they're still reliant on the same workforce, we are still going to hit at the point where demand might outstrip supply.
Yeah.
So we really need to start looking at, how do we build that consumer confidence and their capacity and their skill set to look after themselves when we advise them that it's safe to do so.
Interesting. And so what would you, I think about from my own perspective there, where we have, if you're a patient or more often a carer, if they're engaging with Healthdirect, and you're like, and I imagine the interaction goes, if you're unsure, of course you could go to the GP. There's always like an element of, look, I'll go just to be safe. But like what I hear you saying too is that if we can address that uncertainty with an on par or an appropriate level of care through another modality that doesn't involve them clogging up the system, for want of a better term, or utilising the system for something that was not perhaps necessary, then I guess that benefits overall.
Yeah, that's right. And so we did some consumer research last year. We used a human-centered design research mode to talk to people, and we also talked to nurses as well. And we did some prototyping with consumers to look at what types of solutions might work for them. And one of the key findings, I think the word that it summarises for me is worry.
Yes.
So when we're talking about it's really common for a parent to have a child that has a fever, they're screaming in the middle of the night, they just genuinely don't know what to do. It might be their first child. Yeah. That sense of worry is huge. And so we found 3 key things that I think are really important. Firstly, the pandemic has really trained people to worry about symptoms that they previously didn't worry about. So when I grew up, we had an ad campaign that we all knew the words to, which was "Soldier on, let's soldier on."
Let's not give them brand recognition, but yes.
Yeah, exactly.
I'm well familiar with that song, and now it's in my head. Yes.
And now what we know is that you shouldn't go to school if you have a sniffle.
Yeah.
And you should stand 1.5 meters apart. And even today, there's the headphones that everyone's wearing in the silent theaters. And I heard someone say, but that's is that clean? Like, is that a good, clean, you know, so that
yeah.
we've trained people to be quite cautious about something that previously they might have had more confidence in. And so as a result of that, they're worrying and they're taking a wait and see approach before they might head to ED. But that wait and see, because they know that ED is going to be an 8-hour wait. They don't want to wait for 8 hours. You know, they don't want to be tired when they wake up in the morning and maybe miss work. But the problem is that wait and see is only lasting as long as their confidence and skill lasts for them to look after those symptoms effectively. And sometimes those can be quite variable as well, you know. So we do want them to call us. We'd like them to call us back.
Sure.
And then the final thing is that whether it's going to the GP or going to ED, what we found was that consumers are looking for reassurance after that. So they're still leaving going, okay, you've given me advice, but I'm still sick. I'm still worried. And so there's a real opportunity for us to think, well, it's not just a single interaction. These consumers leave and they feel alone and they're still worried. So how might we extend that moment of care and have some kind of check-in or interaction with them? And so some of the solutions that we designed together with the consumers were really trying to target those moments of that post-care reassurance and also you know, making the advice simpler and easier and more personalised to interact with using like a RAG AI model. So that it's just when you're tired and sick, you can get something that's not an 11-minute read.
Yeah.
You know?
Exactly.
Yeah.